The American tree frog is a fascinating group of small, colorful amphibians throughout North and Central America. With their ability to climb trees and sing sweetly at nighttime, they make for a charming addition to any backyard or garden. But I'm here to offer you a new meaning to American tree frogs, and to do this, I must explain a current unmet clinical need, redesigning the cardiac stent. Throughout California, cardiovascular disease accounts for the leading cause of death above cancer and COVID-19. In 2020, 66,538 people died from heart disease. Currently, the leading solution to this cardiac crisis is a coronary cardiac stent and angioplasty, a 44.7% sustained complication, a 4.9% mortality device, and a price of $11,000 through $41,000 for one procedure. I created mystent, a medical startup company using the cardiac stent to end healthcare disparities among underrepresented families. My name is Casey Mapano, and I created mystent. And I'm a junior in high school, and hopefully I want to eradicate all healthcare disparities and hope my stent can be accessed through not only the United States but globally. My stent wants to address this crisis by uniting theoretical and applied perspectives on affordable medical nanotechnologies to provide high-quality healthcare to gender-diverse and underrepresented families across their lifespan. Our goal is to educate those about the importance of cardiovascular health and enhance our hexagonal epidermal cell structured cardiac stent. So here's the structure of our design. Our stent mimics the hexagonal cell surface of the American tree frog using polymer and a hydrogel layer. This design uses a mix of adhesive mechanisms, just like the American tree frog, and how they're able to adhere to certain surfaces, such as wet and dry environments. And we took this inspiration by using adhesive mechanisms to attach the blood to the blood vessel, such as van der Waals forces and capillary actions. And in order to stick to the wall, we created a hydrogel adhesive that contains chemicals such as polyacrylamide, polysaccharides, glycoproteins, and protoglycans, and is activated after the balloon angioplasty surgery. And there's certain advantages to our stent, such as special clinical outcomes, and since our redesigned stent provides for superior clinical outcomes compared to existing stents on the market, because our stent can grow with the wall of the blood vessel, reducing the risk of complications such as residentosis and thrombosis, which are common with existing stents, and longer lifespans. Our stent is made from advanced materials that are biocompatible and resistant to corrosion, improving its longevity and reducing the need to repeat for procedures by sticking to the blood vessel walls. This translates to better patient outcomes and lower healthcare costs. And our target market is healthcare professionals, as the cardiac stent's unique design could appeal to cardiologists and other healthcare professionals involved in cardiac procedure. The product's ability to adhere to the artery wall through a mix of van der Waals forces, covalent bonds, capillary action, and hydrodynamic forces and adhesion can make it more efficient in treating complex cardiovascular conditions. Medical as well as medical institutions, as the stent's unique design and adhesive properties could attract research institutes that are interested in evaluating the device's effectiveness in treating coronary artery disease. Lastly, patients are also one of our target markets, as the stent's ability to adhere to the wall using a mix of adhesive mechanisms could reduce the risk of complications as stents thrombosis or residentosis, providing patients with long-term outcomes. And additionally, patients who are allergic to the metal used in traditional stents could benefit from this product's polymer-based structure. And because of this, I encourage all of you to find the real reason for medical innovations and provide the solution to end all types of cardiovascular healthcare disparities by taking a chance on my stent and redesign the cardiac stent for the better of our future and enhancing cardiovascular health and premature death for everyone.